We'll start the class now. So from which chapter are we discussing? Pelvis. So that is from which chapter? Identification chapter. So one sure shot question will be there in your internal assessments as well as in your final exam also from all these bones. So the question pattern would be, as I said before, from the given specimen, determine the medico-legal aspects. তাহলে কি করতে হবে? What we have to do? We have to find about whether we can derive race, sex, age, stature, okay, all those things. So if you can, then you write yes. If you not, then cannot be determined. You write it cannot be determined. Right? Clear? Okay. So last class we have completed pelvis. So any doubt regarding that particular aspect or from that topic, any doubt you have? All clear. So you will be able to identify female versus male. You can from pelvis. Age estimation you can. You will be able to find, no? So what are the parameters for age estimation from pelvis? All went out, washed out. So two methods were there. One is by secondary ossification centers, that is epiphyseal union, right? And the other one was from the articulating surface of the pubis, symphysis pubis, right? So by those two parameters, we can estimate the age from pelvis. Ossification centers, what were there? Iliac crest, then acetabulum, then triradiate cartilage, right? Ischials. Then other things you will be taking into consideration while in the X-ray classes. When we go to the topic from X-ray, in X-ray, there two more parameters will be there. One is femoral head and greater trochanter, lesser trochanter. These parameters will add on in X-rays. Okay, but from the dried bone, these points I told you, from that you can determine the age. So as it is articulated pelvis, so articulated pelvis has what parts? Which parts? Two hip bone, right? One sacrum and ilium, ischium, pubis, right? So we have completed other parts. Sacrum is left out. So we are continue with the sacrum. Okay. So how will you answer what is this? If only sacrum is given to you, you will state as it is shown there. It is a standard answer, no deviation. Simple standard answer. Okay. Because it is a dryad, no. There is no tissue adhering to it, right? It has meaning. There is no tissues adhering to the bone. So it is dried specimen. Okay. So how do you know it is of a human? Second question. Anatomical, from my anatomical and morphological knowledge. Okay. Of human anatomy. Fine. So the next question would be, if the fragment of bone is given to you from this, not the complete bone, how do you know that it is from human origin? Everybody can hear me? Clear? Voice is clear? Okay. So how will you know if only a fragment of the bone, portion of the bone is given to you? How will you identify whether it is of a human species or not? How will you do that? Yes, by a specific test known as precipitation test. That's nothing but precipitation reaction. Human means, as in microbiology, it will be like antibody-antigen reaction. Previously, I have discussed. So examiner might ask you, what is precipitation test? So you should be able to say that. Anybody doesn't know about it can ask. Raise your hand, I will repeat it again. What is precipitation test? Everybody knows. If somebody doesn't know, raise your hand. So what is precipitation test? Precipitation test, we take a test tube, right? And we add normal saline inside the test tube and keep the fragment of the bone Suppose whatever fragment is given to you, from that fragment we take some small fragment from it. Okay, and then we put it in the normal saline, that is in the test tube, and soak it, soak it for some time. Then later on, we add few drops of anti-human antibody. Okay, so antibody will react with the antigen in the bone, right? So there will be a precipitin reaction. There will be a ring-like structure formed between the junction between the two mediums. Okay, so that is precipitin test. That will be coming positive for it. Okay, if there is no reaction, then that means it means that it is not of human origin, because we have put anti-human antibody to it. So if the antigen is human, then only it will react. Fine. So that is precipitin test for species identification, whether human or not, if fragment of bone is given to you. Clear? So coming back to sacrum. Sacrum, what we have to identify is sex and derive the age. Okay, how to determine the sex and how to determine the age. Race we can't determine. Okay, stature we can't. Only two things we can, that is not two, injuries and stains, and that is common for everyone. But chiefly there will be, it is for sex and age. That examiner will ask you. So how will you identify the sex, determine the sex? Suppose like this sacrum will be given to you. So you have to then find the sex and determine the age. So first you have to know few anatomy about it, structures. So as you can see there, this is ala. Ala means wings. Okay. Promontory, this is sacral vertebra. First sacral vertebra, promontory. This is important. Okay. And then these are foramens, sacral foramens. And S1, S2, S3, S4, S5, and then what is there? Coccyx. Okay. Clear? Only this much we have to know in anatomy. Okay, for forensic aspect. Means for anatomy that is different. Okay. Their insertion and what nerve endings, all those things, there we have to follow. Clear? We will move to the next slide. So we we start with determination of sex. We have only two samples. Okay. First thing, in any bone, whether sacrum, pelvis, skull, anything, first is the size, right? Size or morphology, means how the architecture is. So as usual for every bone means for like male bones, it will be heavier, thicker, okay, contours will be rougher, muscular ridges will be more prominent as usual, right, for all bones. So is in this case also. So it will be, as it says, size and shape. Normally you will write heavier and thicker, although you will mention later on, you can mention it is longer and narrower in males, whereas in females it is shorter and wider. Wider though, shorter and wider. So what does it mean, shorter and wider? Somewhat like this, okay, short and wide. Wide means the wings will be more. Ala is more. Okay, wings will be more and it will be short. Clear? Then comes curvature. So in males it will be uniformly curved. Okay. That one is male one. Who is holding that sacrum? That's a male sacrum. See, the distribution is universally, evenly curved. There is no abrupt curve in it. But in case of female, it will be abrupt, means it will move like this and suddenly it will be more, the curvature will be more. Okay. So it states like curvature not seen in upper half, lower half curves suddenly. Okay. It will come like this and suddenly the curvature will be more. As in this case, see, it has come straight, and then suddenly it moved anteriorly. Okay? So these features may coincide, means in males and females may have similar features. In that case, we have to take more number of features. So like there are 6 features we have here, 6 to 7. In the next page also there are 2 more indexes and all. So out of 8, if you means take the majority, then only you can guess it, whether it is male or female. Okay, there are chances you will be wrong, but still you have to take consideration of these points. Means in court also you have to write it that from these features I am of the opinion. Okay, from these features, not imaginary features, from the given species, means facts. So you have to, in exam also you have to write, but you will not write both for male and female, whatever you find, the findings. Okay, so suppose if you have a male sacrum, so you will write the parameters of male sacrum, not the female ones. So somebody gets a female sacrum in their exam, so you will write the features of female sacrum, not both, any that you will support in your opinion, and that is your support for your opinion. Clear? So suppose suppose I am holding a female one, so I will write what you will. I will start writing with the size. I will write shorter, wider. Okay. Then I will write about the curvature. So anterior portion means upper half is straight, and then it suddenly curved. Okay. So like that I will state. Then comes this sacroiliac articulation part. This is very important. Very important. So the examiner, when they get this specimen in their hand, they check this part. Okay, they also don't know, from the first glance, they can't make it out whether it's male or female. So first they check this part. Okay, this sacroiliac articulation. So in males it will be about 2.5 to 3 vertebrae. Means you see here, 2.5 to 3 vertebrae. Means when you compare with this foramens, okay, or this line, so this will extend below, okay, it will be coming down. Then if it is 1, 2, this is 3, okay, third. So it has not crossed third to 2.5. So up to 2.5 it is female, fine. But 2.5 to 3 is males, right? So there might be coincidence that few sacrums are 2.5, which will fall both in male and female also. Till 3 it is male, till 2.5 it is females. Okay, but 2.5 to 3 is males. So 2.5 is common. So sometimes some sacrum will be like that also. Then we have to take other points. So other points is this sacral promontory. Okay, you see here promontory, this part, anterior part. This will be more prominent in males. That gives the heart-shaped appearance of the pelvis. Remember in the earlier class, heart-shaped pelvis. That heart-shaped is due to this promontory, that is more prominent. See this part, this one. This is more prominent. This is a female one, okay. So male one it will be more prominent. See here, it is more prominent. This will give a heart-shaped appearance of the pelvis. Fine? Clear? Any doubt? No doubts. Sacroiliac articulation. Sacroiliac articulation is this part. Sacroiliac articulation. Okay. So if this thing extends beyond 2.5 to 3 vertebra, so you check these holes, these foramens. So this, see where it is ending, not 3, at about 2.5, right? Matching these foramens, right? So it is, yeah, you can check, or from these transverse ridges, lines. Okay, you can compare from there also. So this is second, right? This is ending here. So it is about 2 to 2.5 is females. So clear? All the 4 points we have discussed are clear. That's are the most important ones. While answering the questions, you have to state all those 4 points. Right? Starting from the shape, size, then comes the curvature, then comes first sacral vertebra, prominency, then is this sacroiliac articulation. That's very important, sacroiliac articulation. Everybody has understood sacroiliac articulation. Any doubt regarding it? They will ask you to show me where is the sacroiliac articulation and where it ends. And that's a must question. Okay, sacrum মানে ওটা জিজ্ঞেস করবে। Clear? এনে ধর এটা নিয়ে এটাও নেই। Okay. So you can see the transverse line? No, anteriorly. Transverse line is there? Transverse line is there? Anteriorly? And see where the sacroiliac articulation ends. You get it? Now coming to metric part. This was morphology. Now comes measuring the thing. So metric is always better. Measuring things, we can form indexes and all. Okay, that is this part. So we use 3 indexes. First is sacral index, and other 2 are. Sacral index is anterior superior breadth of the sacrum by anterior length. Okay. This whole portion, okay, by the height of the, okay? I'll show you in picture. Anterior superior breadth of sacrum by anterior length into 100. We get a value. From that value, we can say whether it is male or female. Okay. Anterior superior breadth by anterior length into 100. Clear? Other 2 indexes are, this is sacral vertebra, first sacral vertebra's breadth. Okay. And this is breadth of the wing. Width of wing, breadth of first sacral vertebra. From this also we can form indexes. One is Kimura base wing index, where width of wing is taken and the denominator will be breadth of first sacral vertebra. Width by breadth of first sacral vertebra into 100. We will get some values. So values are here that you have to memorize, that I can't help you with. So if it is below or above, accordingly we will get to know whether it is male or female. Another one is corporobasal index. Here breadth of first sacral vertebra is divided by anterior superior breadth of whole of it. This by whole width. Okay, anterior superior breadth of sacrum. From that also we can get an value, and that we have to check whether it is more or less. So these values are there. So you have to by heart those things in exam. So from that also we can differentiate. Clear? This is metric part. So this is how you determine the sex. Very easy, short. Easy kichu nahi. Another one easy is there, that is sternum. That's also easy, but age estimation is, you have to know few things more in sternum. Sternum we will take another class, or if time permits we can take today also, no problem. Okay, we are clear with this? Right? Now we will estimate the age. Age is very simple. Estimation of age is very simple. Not much to by heart. Okay, how we estimate the age? These 2 points and it's over. So these things, they unite by 20 years of age. Okay, all these things. Okay, and this the first one, Means first sacral vertebra and second sacral vertebra, there remains sometimes there will be non-union also. That is called lapsed union. Okay, it may not fuse. Okay, it's not like that it will be always, it has to fuse, it's not like that. It may remain unfused in the central part. So the whole thing fuses up. So normally it fuses by 20 years and the whole sacrum becomes a one bone by 25 years of age. Okay. So if you find these sacrums, this is above 25 years. So if somebody asks you that what would be the age, you will state the age is, in my opinion, the age is above 25 years. Clear? Very easy. बुझा गया? The union occurs from below upwards. That's same as in sternum also. That we will discuss later. See here, even though the central area may remain unossified up to 50 years. Central area means this part. I will show you this. Okay, here it is fused. You see here the fusion is very prominent, right? But here you can see there is a little gap. Okay, so sometimes, but it is fused. In certain sacrum there will be non-union, lapsed union, means there will be gap here in between the first and second sacral vertebra. Okay, it may remain unossified, means it may not be fused. So it doesn't mean that it is below 25 years. It doesn't mean that. It is above 25 years, but it may remain like that till 50 years of age. Fine? Clear? So you can write about sacra, very easy. Other things is, what we can get is deformity, okay, disease deformity, and then if there is a detection of heavy metals like lead, antimony or something like that, that can be detected, arsenic, such things can be detected. If there is injury, that can be detected, right? All those things as usual, as we have discussed earlier. Clear? So that completes our sacrum. So articulated pelvis is over, right? These are individual. This is not part of articulated pelvis. This is part of articulated pelvis. Okay. Now, mandible. Mandible is taught, right? I have taught you mandible. So we have got few more specimen. You can go through it. Okay. Tell me which one is which. So regarding age estimation from mandible, which parameters will you take? Age estimation from mandible. Mental foramen. Okay. From mental foramen you will get to know whether it is infant or adult or old age. Okay. So better parameter is teeth. You have to count the teeth. Teeth means erupted teeth. Okay. Erupted means those which have erupted and may have fallen. Okay. But you will count those. It's not like that those attached to the attached teeth only you have to count. It's not like that. You have to count the sockets. Socket বুঝতে you know na socket. Yeah, you can see here there are sockets. You will count them. Okay. So if it is 32 means only mandible means you will get 16, right? 16 into 2 is 32. So if in case there are 16 sockets with teeth also, so what would be the age? Age will be above 17 years because third molar erupts at 17 to 25, right? So the age will be above 17 years, right? Clear? So if there are no teeth, teeth nahi, the sockets are almost undulated, means there will be smoothening. Okay, you won't find sockets. So what could be the age? It will be of a old person. You have to check the mental foramen, where it is in the mandible, whether it is above or below. So in both age group there will be no teeth, right? In infancy as well as in old age. So you have to check where the mental foramen is. Okay, whether it is above or below. If it is below, then infants. If it's above, then it will be old age. Clear? It may not be there. There will be recession. Okay, it can be recessed. There will be recession. Yeah, that's what. That's why we will take the mental foramen. Anyway, we'll know because in children means infants means the mandible will be so small, right? The size will be so small. Anyway, so those things you have to know. And other is, tell me about how will you determine the sex. First thing you will check is whether this is everted or not. This will give you a very good idea whether this gonian, this part, this is gonian angle, okay. This is everted or not. If it's everted means males, and if it is not everted, if it's straight or normal means straight, then it is females. Other things is means this is the most important criteria. Other is the architecture and all, whether this symphysis mentum is rounded or more larger and all. But best is this one. Okay. Other things, yes, yeah, shape will be, yes. So that shape also will give you whether it is male or female. If you hold it like this, you will get the shape, right? This shape. If it is more U-shaped or square shaped, it is male, whereas V-shaped, it will be female. Clear? This is male. Okay, this is heavier. Anyway, you see here the contours and all are rougher. Female, anybody has female who is holding there? You check for the margin, everted margins are there or not. No, all are male. So this is also male. See, if you touch here, it's outward. It's outward. Give this one. Fine. Yeah, both are male. Right? So we have revised mandible and we have completed sacrum. So next class we will read about sternum. Sternum, if I have slide, I will show it right now only.